Hi, I'm Dr. Dan Rubin. I'm at the 2020 annual convention of the Oncology Association of Naturopathic Medicine, getting to talk to my very long time good friend and colleague, somebody who I went to naturopathic medical school with, Dr. Daniel Kellman, a naturopathic oncologist and director of naturopathic medicine and nutrition at Cancer Treatment Centers of America in Atlanta, Georgia.
That's right.
Dr. Kellman. All right, it's been a long time. It's
Glad to be here.
Yeah, it's great to be able to sit down and talk about what you do, because I know because we talk all the time, but Cancer Treatment Centers of America has really supported the field of naturopathic oncology. How's your experience been? And also, how did you choose CTCA?
Well, it's been a great experience. I've been with CTCA now for 14 years.
Wow.
I was in Tulsa, Oklahoma for 6 years, and now I've been with Atlanta for 7 years. I actually was part of the opening team there.
I remember that.
Moved out just before we had opened, and going on 7 years.
So you really helped build that department.
Absolutely.
Yeah.
So what got me into naturopathic oncology was that I started seeing patients when I was in practice in Arizona, and about half of them coming into the practice I was working at had cancer. And I realized that naturopathic medicine, naturopathic oncology, is so well suited for cancer patients because we look at the whole person. We're not just looking at the physical, the cells and the tissues, but addressing mental, emotional, spiritual, energetic, all of the aspects that patients are dealing with throughout treatment and beyond.
And you do that at CTCA?
Absolutely. Yeah.
What about your physical plant, your physical space? That's, I understand, changed throughout the years too. What's that like?
Well, we have a integrative care center, and we have a check-in area. We have a consultation room. Each of the naturopathic physicians has an office where we consult with patients. We also have an acupuncture and chiropractic suite, and we deliver those treatments. We have a chapel, and we have pastoral care also operating on that floor. We have schedulers. We also have our nutrition consult rooms as well for outpatient nutrition consults.
It's wonderful. It feels very real, I assume, for patients to feel like they're getting very high level, top of the line treatment too.
Yeah, it's really one of the key differentiators for Cancer Treatment Centers of America, and really is something very unique within the hospital-based tertiary cancer treatment model.
What does that mean, tertiary cancer treatment care model?
Well, it's really an integrative model of treatment where everything is available under one roof. And so,
meaning like surgery?
Absolutely.
Radiation, chemotherapy, gastroenterology.
Exactly.
Do you have primary care?
We do. We have internal medicine.
Internal medicine.
The surgeons are talking with the radiologists are talking to the medical oncologists. We're able to deliver the treatments. We're able to look at labs and scans in real time. We share a
because you have your own labs and your own scan.
Absolutely, and we get the results very quickly.
Wow. Your team then, so you helped build the program, you were there from the beginning, you've built it, you've seen the development of a whole brand new center, and you're in charge of the team. What does your team consist of, or whom does your team consist of?
So we have, including myself, 3 full-time naturopathic physicians that are all naturopathic oncology trained. We also have a part-time naturopathic physician. I'm also over the nutrition department, and we have clinical nutrition support certified registered dietitians that are able to handle the metabolic GI complaints, handle tube feeding, handle TPN, so parenteral or IV nutrition. And then we also have outpatient dietary modifications. We support surgery pre and post-op with a program
critical.
that is similar to the ERAS, which is Enhanced Recovery After Surgery. We call it the ASSURE program. It's Advanced Surgical Recovery.
And we just had a presentation that you and I were both watching about how important and based on data it is to use nutrition pre and post surgery and what it can do for overall survival.
Absolutely, and there's data, and there's a lot of cost savings involved as well, because there's data to show that you would go from 14 days of after an abdominal surgery to even 8 to 10 days with some of these things that we do pre and post op,
Wow.
to now actually with our program 4 to 5 days on average. So it's an incredible advancement in the way that patients can recover.
I imagine that it's great for a patient at the center to know and to feel good and in their heart that their doctors are communicating, because kind of out in the wild, you may be going from practice to practice and sort of who you get referred to or kind of how you put it together. So it's really a unique model. And what I've respected about CTCA is that they really have honored and understood the value of the naturopathic oncologist in the continuum of cancer care.
Yeah, you know, I think anybody can go get cancer treatments just about anywhere, any big city, any large cancer center. But the question is, can the patients get through the treatments? And I think that's one of the primary roles that we can offer is helping patients get through the treatments with dignity, with a lot less side effects, with maintaining immune system function. You know, we want patients to be able to have quality of life, to be able to do the things that they love to do, like exercise, like engage in their hobbies, play with their children or their grandchildren.
Yeah.
And so
Wonderful.
we almost have a resort-like atmosphere as well. So patients actually have commented, I love to go to CTCA. I love coming there because they feel at home. We're like a family.
I love it. One question I have is about the food. I've heard that the food at CTCA is wonderful, it's nutritious, it's balanced, and that some of it is even, at some cancer treatment centers in America, is even grown nearby. How's the food?
Food's amazing.
You have chefs
We have a sous chef. We have even the dietitians being involved in menu planning, and you know, we're also asked for our input as well as naturopathic physicians, and a lot of fresh foods, a lot of phytonutrients. We talk about the cancer-fighting properties of foods as well.
And then they can go eat them in the very center where they're talked about.
Absolutely.
Wow.
Yeah, so it's absolutely incredible and needed.
It's a wonderful amalgam. Well, sounds like a really good teamwork atmosphere, and I think that from what I've known in our discussions, it's amazing work, and thanks for sharing.
Absolutely. So glad to be here.